All right, welcome everyone. I want to go ahead and call the meeting to order. This is the monthly meeting of the El Dorado Hills Community Council. It's Monday, April the 4th. We have several items on our agenda today that are kind of unique, but we always start out with our roll call of the leadership team who's present, and then also recognition of District 1 commissioners and committee members who may be present or attending via Zoom. So with that, I'm going to start over here with Glenn, and if you just give us a couple of CCs of what your role is on the leadership team.
Well, good evening, afternoon. Glenn Krakow. I represent economic and community and economic development for District 1 at the county.
I'm John Davey. I'm the chair of the El Dorado Hills Area Planning Advisory Committee, and we're a resident group of volunteers that looks at proposed development projects in El Dorado Hills and provides feedback from the community to the development process.
So welcome, Richard. You want to go ahead and just introduce yourself
Richard
briefly?
Ross. I sit on a chair that relates to good governance as to how government works or doesn't work and what is going to be happening.
Good. I'm John Heidel, District 1 Supervisor. Over to you, Cindy.
I'm Cindy Munt. I'm Supervisor, Heidel's Assistant, and I do community information and outreach for the Community Council.
Good afternoon, Mike Leyenthal, Deputy Chief of the El Dorado Hills Fire Department, and I chair the Public Safety Group. So I try and coordinate any citizen issue with the appropriate agency to help mitigate that problem.
Very good. So it looks like we are missing Angie. I thought she was going to be able to make it. Evidently, that's not going to happen, right? And then John Vania. So we have two of the leadership team members who are absent this evening. So we'll just go ahead and proceed with that. So with that, we want to identify committee members or commissioners who are either present or on Zoom. So Tita, would you like to introduce yourself and what your role is?
Tita Bladen, El Dorado County Commission on Aging.
Very good. And I don't see anyone else. I will note that we have our DOT Director, Rafael Martinez, is with us on Zoom this evening. So if we have any questions related to infrastructure, DOT, planning, et cetera, we can certainly access Rafael for hopefully some quick responses and get those going. If not, he can, I'm sure, take an action to get us some responses. So, yeah. So Tim also is LAFCO member as well as APAC, as well as the El Dorado Hills Fire Department. So he's not an official leadership team member, but he's involved with so many different things and wears so many different hats. So Tim, you want to just tell us a little bit why you're here tonight?
I think here I'm officially the vice chair of APAC. That's why I'm here now.
Right. Very good. So Tim White, for those of you who do not know Tim, so welcome. And with that, I don't see any other committee or commissioners present. So we'll go ahead and move on to item 2, adoption of the regular meeting agenda. Does anyone on the leadership team have any proposed changes to the agenda as presented? Okay, seeing none, we'll accept the agenda as being adopted as submitted. We'll move on to public comment. This is the opportunity for anyone present either via Zoom or in the chamber here tonight in the conference room to go ahead and make a comment, ask a question to the leadership team of something that's not agendized. So something that's beyond the normal reach of the work that we cover. And so with that, Maria White has a comment for us, so please.
Well, I heard a question floating about, has anything happened or anything new regarding the Costco that might be coming to El Dorado Hills? Might you have an update? So
There's
we can
no
report back?
official information we can share at this point.
I have heard from the planner, they're talking about the fall, October, November, before we see like a draft EIR. It was the summer, now it's the fall.
So it keeps slipping out, but I'm not sure.
Is that their revised plan?
They have not notified us of any changes yet. I know there are changes being analyzed. I'll leave it at that. We're not privy to it.
There's no official public information that we can share at this point relative to where they are in that process. It's been belabored process from the standpoint of getting things done. There's two different entities involved, and that's part of why it's taking so long for various things to come forward. But it sounds like it's starting to happen now at a little bit better pace, but to be determined. So I'm sorry, but there's really nothing we can share with you at this point. A lot of discussions going on, including Raphael's discussions on things, but nothing that we can really share. So, Raphael, unless you have something you can add to that relative to the discussions with Costco? Are you there, Raphael?
Yeah, let me get him.
There he is.
Can you hear me now?
Yeah, you're on. Okay.
Yeah, there is, just like you said, Supervisor, no additional information. We are working with them with their traffic study, but that is more the scoping of the traffic study. So there isn't anything at this present time.
Very good. Thank you for that. So anyone else present in the conference room who has a public comment at this point? Okay, then let's go to Zoom, and I know that Hillary's got her hand up, it looks like.
Go ahead, Hillary.
I've been trying to find more information on the Central El Dorado Hills specific plan development. And I know it's been mentioned it's coming back to Planning Commission. I don't see that it's on the next meeting, but do we have any more information as far as any of the what's been changed, or is it going to be recirculated again? Or I mean, what is, I know DOT was reworking something with it. Is that correct? I and many other people are confused on what's going on with that.
Yeah, so I was going to speak to that a little bit under supervisor communications. We did have the dates that the Planning Commission meeting has been scheduled. So I think I'm going to hold until we get to that point, Hillary, but we will definitely share with you the information that we have. And that's kind of a situation where there's been a lot of delays in that timing as well for various reasons. So I'll share that with you when we get into supervisor communications, if that's okay.
Okay, so we need to stick around for the whole thing then?
No, it's going to come up very quickly after the guest speakers. I can address it now if you want. That's fine. I'll address it now.
I would prefer that. A lot of people are just having that question.
So my understanding is the Planning Commission is scheduling 2 meetings. The first meeting is going to be more of an orientation, history type of session, because we will have 4 commissioners who did not participate in the original Central El Dorado Hills public hearing that was held down at District Church. So my supervisor, our District 1 supervisor, John Vania, is the only one who attended and was on the commission at that point. So that's the reason I think for the first meeting is so that the public can get oriented to what the project again is. The new commissioners can get oriented. There will be a, what I'm going to call a draft, a development agreement that has substantially changed from the development agreement that was in place as a draft probably almost 2 years ago. So there's been a lot of proposed changes to that. And our county staff has been working with the developer to define what those new modifications are. So that will be made public. The second meeting then is really to take more of the hearing information on vehicle miles traveled in particular. That's the one item that's related to CEQA that the Planning Commission was not able to basically deliberate on. So they will be taking information on that, deliberating on it. And then I'm sure there'll be other questions and comments as well. But they're anticipating being able to make a recommendation or forward a recommendation by May 12th to the Board of Supervisors on that particular project. So if all that plays out, that's where we should end up. Always subject to change. That's why I'm been a little bit hesitant at announcing the dates, because they've changed about 3 times in the last 3 weeks. But I think we've finally gotten to a point that we can lock in on some dates and get things in people's planning. I did ask Cindy to put out a notice of that to everybody who had sent us comments, so they know the anticipated dates to get that going. Recognizing we can't accept public comment until Legistar opens up, and that's probably going to be 2 weeks prior to the meeting on the 28th. So April 14th is when the information should be on Legistar, and we will start taking public comments. But I wanted to get the word out to people, so it's, well, you never told me, or it's way too late, or whatever. We're going to get the notice out early, but we will not be able to accept formal inputs, comments until that point in time, and then the Board of Supervisors will be able to accept those as part of the Planning Commission Legistar items. So that's kind of where we stand. Anything else there, Hillary, we might be able to answer?
Well, I don't see anything on the April 14th meeting, on the Planning Commission April 14th
It's
meeting.
April 28th. It's April 28th.
Okay, that's
It got
because
bumped back 2 weeks, unbeknownst to me when I put the draft agenda together.
Okay,
So our
so-
communication has not been great.
Okay, so if it's on Planning Commission for the orientation meeting,
On the
then,
28th, right.
okay, then they'll have another meeting after that before the May 12th
May
meeting?
12th. May 12th is the deliberation meeting. So the public's welcome to attend both. For a lot of people, a good refresher on where the project is, where it started. There's been a lot of things that have happened over the last almost 2 years, and a lot of things particular to the development agreement that have been modified. So that will be the first opportunity to publicly share that, is when it gets posted on Legistar and then at the April 28th meeting.
Okay, so it'll be the development agreement, the new one, that will be posted on the Legistar, that we can read that.
What I'm going to call the draft, yes, because that's not finalized.
Okay.
That is really the way our current policy is written. We have a team at the county who's responsible for meeting with the developers and putting together that development agreement with a lot of puts and takes. The El Dorado Hills Community Services District was participating in the discussion, although they didn't have any direct voting rights per se. But we're trying to get that finalized. And I think the last thing that we're trying to rein is to get our auditor controller engaged with that last meeting so that he has a clear understanding of what's in the development agreement before it's presented to the public. But I think that was scheduled for like the 24th of this month. So that's all happening late. So again, there's been a series of things that have delayed things. So.
Oh yeah, I know. I thought they were reworking. I guess I need to be a little more educated on development agreement. I thought they haven't even picked a alternative yet, because they have all those alternatives. So I didn't even, I guess there's been no alternative. There's like 4 or 5 alternatives. 2 more came up at the recirculated draft. So has any alternative been selected?
No, it
Okay.
hasn't. That will not be done until the board deliberates on it, which is now probably going to be the middle of June.
Okay, thank you.
Yep. Okay, any other public comments or questions? All right, seeing none, let's move on to our guest speakers, the most exciting part of the meeting, right? So it's my pleasure to introduce our 3 guest speakers this evening. They're all from the Public Health Services Organization. So we have Olivia Byron Cooper here with us. We have Kristen Becker, and we have Christy White. And so what we wanted to have them do is to share with us all some of the information that they have relative to the services they offer and some of the new initiatives they've got going. I've had an opportunity to personally meet with them and talk about some of the things that I want to get behind and support. But it's all related to public health, as opposed to our emphasis in the past has kind of been the mental health side of the organization. So now they're here to kind of share with us on the public health side. So over to you, Olivia.
Okay, well, thank you for the gracious introduction, and thank you for having us this evening. Really appreciate it. Really excited to be here. We actually have Heather Orchard and not Christy White.
Oh, okay.
Yep, she is one of my great colleagues who oversees the communicable disease department, and Kristen Becker is overseeing the health promotions, health education part of the unit. So I thought that I would provide a brief overview of what we do, and then open it up for questions so that we can just have an informal dialogue, if that works for everybody. I am relatively new in the public health director role. I've been here for about a year now, although I've worked in the public health sphere for much longer in this county since 2008. So I started out as the epidemiologist in the department for a while, and then I went outside of the department and got really into program evaluation and quality improvement. And then I came back in the middle of the COVID pandemic to help with the department. And I think that part of my job is really to get out into the community and make sure that everybody understands all of the services that we provide. And I also think it's important that we reach out to all of you when we are working on new initiatives to get your input. And so I wanted to start developing a relationship with members of the public early on so that you know who I am, and when we're starting to work on something, I can reach out and get your input to make sure that we're reflecting the community the way that we should be. I think it's really important to distinguish public health as different from our other healthcare partners in that we focus primarily on community prevention initiatives. So the only time that we really get involved with direct patient care or treatment is if we are working on something that has a strong preventive focus. So I like to use tuberculosis as a good example. We do provide treatment and intervention for people who have tuberculosis because we are trying to prevent a major outbreak in the rest of the community. So that's where we do a little bit of direct patient care, but for the most part, we are in the business of educating and providing preventive services. And that's how we're a little bit different from our other healthcare partners. We literally provide services from cradle to grave. And I say that because we provide death certificates and birth certificates. That's one of the functions of the public health department. We do car seat education, installation, and provision. We provide services to care for children with special needs, services for families. We have nutrition education, vouchers for families who qualify. And we also partner with some of the other services in the community, like the hubs, for example, to make sure that we can link people to services. So if at the very least, at the end of this, you come away with knowing that if you have something that is health related, especially in the prevention piece of health, that you can call us and we will help link you to services even if they are outside of our division. That's something that we really take seriously and will work very hard to do because there are a lot of services within the community that are outside of public health that really interface with the work that we do. So with that, I wanted to open it up if any of you have any questions. I don't know, Heather or Kristen, if you have anything else that you'd like to add as an overview before we open it up for questions.
I just wanted to say thank you very much, Mr. Heidel, for inviting us.
Can we get a microphone because we need to make sure there's a microphone there.
You can
Yes.
come up here.
Make sure you can just turn on, make sure it's green, and then you can speak, and then you hear it. Yeah, we're good.
I just wanted, Supervisor Heidel, I just wanted to thank you so much for inviting us tonight to come and talk a little bit about the Public Health Division in El Dorado County. And yeah, we're here to answer any questions that you have. And like Olivia said, we really want the community to get to know us and feel comfortable coming to us with any questions or concerns at any time and know that we are responsive and we care and committed to the health of our community. So thank you for having us.
Some of the initiatives you guys are looking at, because I think we would like to have you come back and just speak specifically those initiatives.
Absolutely.
But I think to cover those kind of sets a framework.
Yep.
Right, for what's to come, and I think that'll get more
Why don't you come up here and talk about some of the work that you're doing, Kristen? And I think that's where, you know, my comment about wanting to involve you as we move forward, that's where this comes into play because we want to make sure that, again, we're representing your community the best that we can.
Good evening, everyone. I'm Kristen Becker, Program Manager within the Public Health Division. Happy to be here. I oversee the Health Education and Promotions team, and that's a team of health educators and health program specialists. The focus with that unit is on 4 major areas. It's tobacco use prevention, oral health, women, infants, and children, which is a nutrition program. It's known as the Nation's Nutrition Safety Net program, and the Supplemental Nutrition Assistance Program Education, which is another nutrition program. So within the Health Ed and Promotions unit, our focus is on health promotion, education, disease prevention, and one of the most effective ways to improve the health of a community is through policy. So my team does a lot of health policy related work, and that's where a lot of our community partners and elected officials come in because they're in positions to update ordinances or to approve policies. And I feel like it's our job to present the information that is evidence-based, that has been proven to be effective, and to be really partners in improving the health of our community. So that's, I don't know, Supervisor Heidel, if you would like me to go into more detail about some of the policies that we are pursuing or looking at.
Briefly mention them because I think it's important to understand the policy aspect of this, because that's the way we change things ultimately internally within the organization. So.
Yeah, so for instance, tobacco use prevention is a big program. One of the key focuses within that program is protecting people or reducing their exposure to secondhand smoke. And how do you do that? You can do it in multiple ways, but the most effective way to do that is through policy. So then you think, okay, what type of policy would you be considering or looking at? So policies that have been proven to be effective are, let's say for the county, you start from within, so smoke-free campuses. Or multi-unit housing. Now, multi-unit housing where people live is not only just where they live anymore, they work. And they're susceptible to secondhand smoke. So that's become a really big focus of ours as well. So those are like two policy examples. But then we look at different policies within nutrition and oral health too. A fact about oral health, tooth decay is the most common chronic condition experienced by children. So we look at how do we prevent disease. If it's, most of the things that we work on are preventable, which is also really exciting. So what can we do and partner with the community to improve some of these statistics? So it's a very exciting unit to work in. And one of the things I enjoy most is getting out, like Olivia said, and working with our partners. So
That's
thank
a good
you.
synopsis, so I appreciate that. So it gets enough to set the stage for the next section.
And I would love to come back and do
Yes.
a presentation on oral health or tobacco use and or the nutrition.
Tobacco use and vaping and all those things, I think, people need to understand the difficulty involved with trying to write policy, is the enforcement part of it. And so you have to really look at what is the creative way to make it self-enforcement, as opposed to expecting our law enforcement agencies or somebody else to go around and tell people, no, you can't smoke out here, right? So that's the creative part of it. So we'll get into that in one of the subsequent discussions. Because I think the public may have some comments relative to ideas on how that works or doesn't work.
That'd be wonderful.
Yeah.
I look forward to it.
We'll definitely take that in. And then Heather, if you wanted to have a few minutes just to introduce yourself and give us a little bit about some of the initiatives that Christy's got going on. And yeah.
Hello, thank you. Nice to be here. So as Olivia said, I'm a supervising public health nurse for primarily communicable disease in our clinic services. And communicable diseases are all Title 17 reportable diseases: tuberculosis, pertussis, so vaccine preventable diseases, E. coli in healthcare workers. We have a requirement to ensure that those individuals are not at work providing patient care when they are infected. So our role there is we receive reports and we follow up with those individuals at the highest level that are the highest risk to spreading those infections, and work to control that and stop the spread. With regards to that, sexually transmitted infections is a big part of that, and it's on the rise nationally. It's on the rise in our county as well. We have goals and plans to put work groups together, because what we would like to do, instead of being on the receiving the reports, we want to go out and do the preventative measures. We want to go out and talk to our providers. We want to talk to our community members to let them know how important it is for pregnant women to get into their providers to get that prenatal screening for various reasons, not just to detect syphilis. We want to have our community members understand in an easy, understandable way of what is important, and work with our providers to ensure that the care that's recommended is the care that they're providing. And so as we get back into the swing of things, so to speak, that's our goal, is to get work groups together, get our community health advocates, our health program specialists, health educators out into the community, as well as myself as a provider, to get out and talk to those so we can fight it together. Thank you.
Thank you for that. Yes. Okay. So I think we're now at Q&A.
Absolutely. Open
to trying to answer any questions that you may have, and if we can't answer them, we will get you the answer.
Let's start with our leadership team. Any questions from our leadership team? Yeah, Richard.
Apart from COVID, have there been particular concerns in the public health area as to trending illnesses, diseases, or compromising circumstances to individual health? What trends up and is maybe faded?
Oh, yes. So one thing I can tell you is flu right now is very low. I think one thing that we've learned from the pandemic are good hand washing and our good hygiene and things like that. So one thing that's good is that the numbers of flu vaccine right now, or flu illnesses, is very sporadic throughout the county. It's also very sporadic throughout California and the nation.
We're seeing increased syphilis rates in general, correct?
Yes, across the nation for the last 5+ years. Sexually transmitted infections, syphilis, congenital syphilis, unfortunately. So babies born with syphilis has increased 300%. And it's something that is preventable. It's something that's treatable too. And good old bicillin is treatable for syphilis. So if we can get our folks and our pregnant women to their providers, get them into providers if they don't have providers, to have those basic screening tests done, then we can work together with them and our MCAH, our field nurses. We work together when the babies are born. There's a lot of follow-up that has to happen after that. So we partner with our internal folks to make sure that those babies and the moms and the families are taken care of.
And that's a really good question because we have seen, I'll just speak to oral health, that we already have a high prevalence of cavities in El Dorado County, but we've seen the numbers get worse since COVID. So we feel like we've also had some staff turnover and some vacancies and with students not being in school, we've seen that have a big impact. So we are ramping up as schools have reopened, and we consider the dental van a strategic partner. We want to see the dental van increase in utilization at the schools. But yes, we've seen the number of cavities that's trending negatively. Yeah.
Other questions?
Oh,
Go ahead.
Yeah.
I can tag on where Richard was at. So my question was more, we talked about trends, and that was my question was about the nutrition aspect, the many things you have to deal with. As an example, when COVID broke out, the schools started distributing a lot of meals. In my kids at senior high school, the school bucks that we used to pay for cafeteria service, where we have not used that since 2020. We have some huge balance on there. It'll probably end up being returned. We'll leave it with the school, whichever. But in terms of that, that's a special program that they put in place. And so maybe the kids are getting a meal at school, 2 meals, I think, a breakfast and a lunch. Do you see that trend, and do you notice that those things might be going away? Or how hard is it to determine a trend before it's a crisis or significant?
So, and unfortunately, the data always lags, right? So decisions are made oftentimes based on old data. And so and we often suffer because we make those decisions a little bit too soon before you actually see what's going on. And that could either be that it's a true trend or that it's just a blip in the radar, right? One thing that I can say is that there's a lot of conversation around the benefits, that some of the benefits that have occurred because of COVID, and that those things we need to figure out a way to sustain over time. And nutrition and providing nutrition to both kids and seniors is a big topic of conversation. So people are noticing the benefits, and I think that's a good thing.
I guess I have a quick question relative to prevention, because that's the name of the game, right? Do we have enough funding in your organization to do the prevention work that we need to do? I mean, there's various funding sources, et cetera, but it's always a question of, are there priorities that don't allow us to do certain things because there's limitations, or do we really have adequate funding to go after the prevention piece?
So the problem with funding, I never thought I would say but that it's often based off of what is the flavor of the day.
Yep,
So
trendy,
right
yeah.
now, all of the funding that is coming to healthcare in general is related to COVID and about sort of preparing for the next whatever it is. And so that limits our ability to work in the space of nutrition or tobacco because it's hard to really draw a nexus. That being said, we're trying to be as creative with the funding as possible so that when we are out doing prevention work for communicable diseases, which is what the funding is intended for, we are also talking about these other things. And so that we're trying to leverage the funding so that we can do some of this other work. But to directly answer your question, no, it would be nice if there were funding that were more flexible for us to work in some of these areas that aren't in the spotlight at the moment.
That funding generally comes from the state government or the federal
Yep.
government, right? So
Yep.
almost 90% of it or something or other. So it's really very limited resources that the county general fund can provide basically to supplement. We have to be very cautious in terms of what areas in public health or behavioral health we choose to invest money in, because we know grant monies are typically 3-year periods, and sometimes they get renewed and sometimes they don't. So it's always that big discussion about how do you best utilize the funds available today, not knowing what they're going to be in 3 years. So.
Yeah. And one of the things that we're really working on in public health is looking at evaluating outcomes so that we can come to the table and say, these are the programs that are really making a difference in our community. So if we don't have enough funds, we can focus them in areas that really make a difference. And I think that's the way that we're going to be able to move the needle in some of these areas. It's just really being smart with our money and putting it where we can get good outcomes.
Leveraging part. Yep. Very good. Thank you. Anybody else on the leadership team have any questions?
No, I would make a comment. I the opportunity to work with public health during the pandemic and at the Emergency Operations Center, and just what an incredible partnership you provided to the fire agencies and support for vaccine clinics and us calling you with our firefighters are sick and what do we do. So really appreciate it, Heather. I know we spent a lot of time and others. So really just compliments for the great partnership during that time.
Very good. Some needed recognition, right?
Yeah, a lot of work there.
It's a lot of work, and COVID was a huge challenge for everybody, and we're not done with it yet. So, members present in the conference room, Tim.
First of all, how many employees or personnel do you have in your department? Secondly, what percentage of your funding and dollar amounts come from the county general fund as opposed to state and federal grants?
Oh, so I am not going to answer the percentage part of it. I'm going to tell you that I will estimate that probably 5%, it's a very small amount comes from the general fund. Part of that is because we're able to, again, we've got this really allocations coming from the state and feds that are specific to COVID, and we've able to stagger those allocations so that we can sustain things for a long period of time. So we've actually decreased our reliance on general fund or realignment quite drastically in the last couple of years. And I can get back to you with a specific percentage, but I don't want to misspeak.
And I think
Member personnel is about, sorry.
Oh, no, I was just gonna say, because I was a budget analyst for 2 years, I think some of the general fund is a match that's mandated.
That's correct.
Right.
We're mandated to match some of the programs in general.
Yep, that is correct. To answer the number of personnel, we've got about 55, and we have 2 offices, but one in South Lake Tahoe and one in public health. Yeah, you're welcome.
Anyone else? Questions, comments? Do we have anybody on Zoom? It doesn't look like it. So again, thank you, ladies, for the overview and stuff, and we'll invite you back for kind of some focused activities in the subsequent months, and try to stagger a little bit so we do, another public health session and then something else and another public health session or whatever, to get a couple of them in there. So thank you again for your time and for participating in person.
Yeah, absolutely. It was nice to meet everybody. Thanks for having us.
Thank you so much.
All right, thank you. With that, I think, Andrew, are you going to go ahead and make your presentation now? Are we ready to bring that up? Very good.
5 seconds. Is this gonna work? You don't have to turn the camera to face me.
Oh, up at the very top, left corner, the white screen with the arrow on it, up over to your right a little bit.
Over here.
No,
Oh, this one? Okay.
that one, yeah. That'll start it. Now you can just space bar it.
Okay, we ready?
Is that the way the slide looks? It looks like it's
Yeah,
only half the image. Okay.
It's cut off. So,
Okay.
okay, so
Yes.
first and foremost, I'm Officer Brown with the CHP. I guess, is this a side, an additional to the agenda? But I was asked by Supervisor Heidel to give a short presentation based on bicycle pedestrian safety. Seems to be a thing that needs to be discussed, but sometimes it's overlooked because it seems like it's so simple. It's just one of those things that we've always done. Before we get into that, I just have to give a small pitch. April is Distracted Driver Awareness Month. We're kicking off a statewide campaign with Office of Traffic Safety. It includes enforcement that is going to be happening. Press release has been sent out to local media as well regarding the whole statewide campaign that's going on. It's also happening locally. We have education campaigns that are going on throughout the area. If you know of an agency, a company, a group, something that I can come in for 30 minutes and give a talk to maybe some of your employees, bus drivers, county drivers, county DOT, Raphael, something like that I can give, in a briefing, something really short, really quick about distracted driving, the dangers of it, things like that. To give you some numbers, distracted driving kills between 3,000 and 4,000 people a year in the United States. That's a huge issue. It also injures about 250,000 people. The financial resources that takes, I don't know, we were talking about just an injury crash costs between just under $200,000 per injury to over $14 million per injury. It's a huge amount of money that's spent and lost from our economy to injuries and deaths that happen on our roadways. Putting down the phone, take one simple act, put down the phone, put it in the glove box, put it in a place that you just can't see it to eliminate those distractions. But it's not also just the phone. It's also other things inside our car. So we know what our distractions are, have an honest internal discussion, have an honest, courageous discussion with somebody else that you may be riding with that's doing something dangerous to prevent those deaths and injuries. So there's my pitch. Now let's get on to bicycle and pedestrians. So with guidance from California DOT, the state of California is incredibly encouraged and going towards multimodal transportation. This includes electronic assist bikes, electronic scooters, things like that are being allowed to be operated in more and more places every day. The legislation is generally caught up with all these modes of transportation. Motorcycles are extremely efficient with, goodness, what did I just pay over the weekend driving to and from Reading on a diesel vehicle, about $6.90 a gallon. So we're talking about something that's we're going to see more and more of this by far beyond any other summer that we've seen with post-COVID and gas prices as high as they are and how cheap these things are. You're going to see these things out like you wouldn't have imagined. So just on this very first slide, you see, what does it say? Cabo Cruiser Elite Max 60-volt electric scooter, bicycle, DUI moped, right? So some people think that this is that alternative mode of transportation. This is not generally a licensable vehicle, but we're going to get into that. And like, what is that, right? You see that driving down the sidewalk in El Dorado Hills, or
That's the point. Driving down the sidewalk at what speed, right?
Or in the bicycle lane at 15 miles an hour, and you think, what is that being driven by a 12-year-old? You know, that what with no helmet, or maybe just a bicycle helmet? What in the world is that? Well, we'll get into vehicle typing of that, but to answer that question, that has pedals. It's a It doesn't even have to have pedals. Sorry, it has no pedals. It has a deck to stand on. That is the same vehicle type as a normal scooter that you see people riding on that's electric. That can go up to 15 miles an hour. You have to have a valid Class C driver license. You have to wear a bicycle helmet if you're over 18, or under 18. If you're over 18, you don't. The only basic restriction that thing has, it has to be in the bike lane, and it can't make left turns. No registration needed, but a driver license needed. So that's something that's very unusual. It wasn't in the design when people were going that direction.
Each of these are what, 28, 35?
Yeah, so we'll get into that.
Okay.
So let's go next slide. So we're talking about e-bikes. So e-bikes have come so far leaps and bounds beyond what was initially envisioned when we're talking about electronic assist bikes. So you can see there, we'll go through a couple of those, but the bottom left, that's kind of what you normally see or what you're going to be envisioning when you're talking about an electronic assist bike. So let's go to the next slide if you wouldn't mind. So this bike right here, it's manufactured, it's over $4,000. It has 12,000 watt motor on that rear hub, and its advertised top speed is 60 miles an hour, or 68.
So it says 68.
68 miles an hour. Okay, that vehicle cannot be registered in the state of California. That vehicle cannot be ridden in any public place in the state of California. But they'll sell it in the state of California, probably with disclosures that will indemnify them from liability. But these are some of the things that are coming out. If we could go to the next slide. This is a thing that we deal with a lot in this county. You'll see it riding down Silva Valley in the morning, being ridden by a student or two. This is called an Onyx, and it's a electronic assist bicycle. It can go when it's in a specific mode that I'm sure it would give you a warning saying this is for off-road only, up to 60 miles an hour on electric only. Okay, 60 miles an hour, we're talking being ridden by maybe a 12-year-old going down the road. And we have a conversation. Typically, it's not going to be a stop, but we had a crash involving one of these in the eastern area of the county. They were going 40 plus down a road. No clue what they were doing, how to handle a motorcycle whatsoever. And when it's going at that speed, it's not a bicycle. It's not a moped. It is a motorcycle. It changes based on how fast you're going, what type of vehicle it is. So M1 driver license, registration, insurance, lights, reflectors, helmet, everything's needed. So it changes a lot. And a lot of people just don't know this. You can just go buy one of these they're not cheap. They're pretty expensive, a few grand, compared to high-end dirt bike or mountain bikes. They're really pretty comparable. I just want to encourage parents or even people that are buying these things, really do your research. All it would take is a simple Google search. You're not going to find the answers on the company's website, as you can imagine, right? These companies want to sell their units. They're going to refer you directly to your local laws and jurisdictions. But a simple Google search would say that you're not allowed to ride one of those with electronic assist over 28 miles an hour. You're not allowed to ride one of those over 30 miles an hour with just electronic assist. And if you do, it becomes a motorcycle. It's not just a moped. Well, what if I keep it under? Can I register it? That one? Maybe. That bike you could maybe register as a moped if you keep it under 30. But we know you can go 60 miles an hour. So that's a motorcycle. So it cannot be registered in the state of California because it doesn't meet the federal motor vehicle safety standards that are needed to do that. Sorry, I'm going really fast, but we got a lot of things to cover. But the next one is generally a matrix. I think this is already on your site, Supervisor Heidel.
Yes.
Regarding what the definition is when we're talking about electronic classes of bikes, the 3 classes, and then we cross into moped or motorized bicycle or moped. Speeds, what things you need to have, driver license, yes or no. So just the biggest thing for that is class 3 e-bicycle. You have to wear a helmet at all times, even if you're over 16. And you have to be 16 or over to ride those. You don't have to have a license, but you have to be over 16. You always have to wear a helmet when you're talking class 3. Mopeds, you're going to have, registration, insurance, all the other things that are needed. And that has to do with how fast it goes, basically, if we're talking about electric only or electric assist. All right.
There's no requirement to label the actual e-bike in terms of what class it fits in, right?
Correct.
So any manufacturer can put it, you don't know if it's a class 2 or a class 3
Right.
until
So-
you read the owner's manual and
Yep.
determine top speed and all those kinds of things. So
Yeah, a lot of times, it depends on what selection you have on the handlebars, what it will do. So that's it. Like I said, legislation has caught up somewhat. And so there maybe needs to be a little more helpful definitions, but this is pretty helpful as far as I can tell. And then when we're conducting enforcement, visual and radar can help support speeds of the actual bicycle that it's going, and then we can make decisions on enforcement from that. You know, we see a guy climbing a hill, not pedaling, going 35 miles an hour. We're going to have a conversation. So, especially with no helmet, no license, no registration, none of that. So let's go to the next slide. Next slide. So this is very common that we're seeing everywhere. I'm seeing it up in Placerville, all over the place. You put a gasoline motor on a bicycle, it turns it into a moped or a motorcycle, depending on how fast it's going. Period. You have to have registration. You have to meet all federal motor vehicle safety standards. You have to have an M-class endorsement. If you do not have that, you will be towed. And if you don't have a license, you're probably going to go to jail. It's a misdemeanor violation, and even on that. So the consequences are severe. And you can imagine how fast that thing could go. I think last year we talked about these. This is a recycled picture from that presentation, but we're talking about rubber brakes, rubber on steel brakes with a gasoline motor. You're not going to be stopping that thing in a proper way to be able to safely operate it. All right, excellent. Next slide. So electric scooters. So this is always prepare to have your mind blown a little bit. So when we're talking about electric scooters, any electronic propulsion on an electric scooter, you have to have a Class C driver license, and you have to be 16. Obviously, you cannot have a driver license unless you're 16. So children riding these to school on a daily basis are operating without a license in violation of the vehicle code. And subject to citation and having that scooter being taken away. So we want to make sure, and this goes into public safety issues, and we'll get into helmets as well, but we're seeing a lot of issues with students, especially on this side of the slope, not wearing helmets, having their helmets sitting on their handlebars, and riding these things blasting down Silva Valley Parkway when they have no business riding these things. The handlebars are like at their chin. These things are high speed, high powered things. So we can go to the next slide. This is very similar to one that we see going to Silva Valley Elementary on a daily basis, pointing you out, just putting you on blast, whoever that is. This is an advertised top speed of 30 to 32 miles an hour. So 240 watts of combined power, has motors on both the front and the rear axle. That cannot be ridden in the state of California. Scooters with power can only go 15 miles an hour, and even if you are riding that, you have to have a valid Class C driver license. So you would be cited for that. So this is no business going down any road in the state of California with that configuration, with no helmet, no protective safety equipment, and not effective brakes. And I don't want to speak for the manufacturer. I'm sure they have excellent brakes and performance on the thing, but it's being ridden not by that adult in the picture that we've seen. It's being ridden by children, which is not a lot. So next slide. So bicycle safety, simple bicycle safety. We all kind of know, and that's some small text, but generally it says, so you have to read and obey all traffic signals and signs. We all know that. That's very simple from day one of the day that we started riding a bike, and when our parents told us how to ride a bike. You have to follow the flow of traffic. You have to follow stop signs, stop lights. You cannot ride on the sidewalk unless you can ride on a sidewalk unless there's a county or city ordinance prohibiting it. So stay to the right-hand edge unless passing. No passengers on your handlebars, right? Your mom always told you don't put your passenger on your handlebars because it's unsafe. No passengers on pegs. You have to have both hands available, so you can't be carrying your lunch in one hand and a fishing pole in the other. You got to have at least one hand on the handlebars. And then also headphones in both ears, like that main picture there, are prohibited by California state law. That's That's the same vehicle code that applies for motor vehicles having headphones in both ears. It applies for bicycles having headphones in both ears. So if we see that, we will make an effective stop on that. So simple things that we all know, the simple rules, but we need to maintain it and talk to some of our kids about it. So let's talk about helmets next. Helmets, so anyone under 18, for some reason it's ringing in my ear, in my head that it was 16, but now it's anyone under 18. On a bicycle, skateboard, scooter, rollerblades, or roller skates are required to wear a helmet on any public roadway, sidewalk, bicycle lane. Right here we have a helmet. An example, we give away helmets for free. California OTS provides these and bought these through grants. We have boxes and boxes and boxes of these that we will give away for free. If you can call me ahead of time at the CHP office. It is surprising how often I talk to kids on roads in El Dorado Hills coming out of the gates of Serrano, an affluent community, where parents are not ensuring that their kids are wearing helmets. It is unacceptable. I can ask these kids, do you want me to get you a helmet? Because this isn't a situation where they cannot go get a helmet. These are affluent communities, they can get a helmet. But if they just want a helmet, we're gonna be having a helmet distribution booth at the fireworks on the 2nd of July. Heads up, it's gonna be on the 2nd of July this year. But we're gonna be giving away tons of helmets. We're gonna be fitting kids. We're gonna be grabbing every kid that's riding a scooter in that facility that doesn't have a helmet. We're gonna be slapping one on their head. But come by my office and you can get a free helmet. I'm gonna start carrying them with me in the mornings when I go out on some mornings. I'm not gonna tell you what days, but some mornings for enforcement, I'm gonna be putting these on kids' heads. They're a very simple thing. They need to be put on your head and fitted right, but come on, we got to put helmets on these kids' heads. We're talking about when a kid is in the development stage of their brain, when they're between 7 and 14, 15 years old, when traumatic brain injury starts then, it will last their entire life. And we can prevent that with a free thing or something that costs $15 at Walmart, if that. So let's take that right step. All right. So again, lighting. When we're talking about cyclists, lighting in the state of California is really simple. There's nothing fancy about it, but you have to have a red in the rear, white in the front. It's very simple, and I have that right here. These are like $1 on Amazon. The grant paid for these. They're branded Highway Patrol, but we got white and then we have a red. And they just like strap onto your handlebars or to the rear post for your bicycle seat. So for the red in the back, the white in the front. Really simple. We have a lot of these that we've been giving away in years past. Don't have a lot now. But like I said, you can go on Amazon. You can buy these things for nothing, and they can go on the bicycle front and back. Reflectors are key as well. But if you got a light in the front and back, you're probably not going to get talked to by any highway patrol officer. So it's very important to maintain that safety at night. And I think we're almost near the end, right? Oh, okay. Last, when we're talking about bicycles. Okay, so 3-foot law. So the bicycle lobby is very strong under the Capitol Dome. They have a law they got a law that was passed to give bicyclists or cyclists 3-foot buffers when they're riding on the right-hand shoulder of the road. You as motorists have to maintain a 3-foot distance between that cyclist when you're passing them. If you've not made any verbal or visual communication with them. So if you just happen to just drive by them, you have to give them that 3-foot buffer. Otherwise, it is a moving violation and a point on your record if you're tagged for that by the Highway Patrol or any law enforcement agency. A lot of people get frustrated. Say we're talking about Malcolm Dixon, right? We have cyclists that like to bypass. They're going to bypass Green Valley Road, take Malcolm Dixon around, and then come back down. And I don't blame them. It's a beautiful ride. It's a beautiful neighborhood. I'd ride there too. But we have motorists that complain about cyclists in groups or packs coming through there and riding and taking up the whole road. And let me give you some insight into really, this is deep in the weeds, but with that roadway width, if that lane is about 12 feet, 11 and a half feet wide, at that width, the cyclist and a vehicle cannot possess that lane at the same time safely because they'd be within 3 feet. So therefore, the cyclist is legally allowed to ride directly in the middle of the lane to maintain their path. And in fact, through training that I've been through, that is actually highly recommended because they're maintaining that lane and not letting other vehicles pass them at high speeds. It could be safer. And I can't really necessarily give that direct advice now, but I just want to give motorists the insight that you're going down Malcolm-Dixon, there's a pack of bicycles taking up the entire lane. That is a legal thing for them to do. They are beholden to the five vehicle have to yield out. So if there's 5 or more vehicles behind them, they have to yield to the right and they have to let vehicles pass. But likely that's not going to happen on Malcolm-Dixon for the length of it. Could, yeah. But we just need to be aware and maybe temper our tempers when we're dealing with cyclists and understand that they are a vehicle that has as much right to that road as your F-250. And we have to maintain a safe working relationship with everyone on the road, including cyclists. Because we know, and they know that you'd win. They really do. They know that a vehicle, if it were to hit, the vehicle would win, the motor vehicle would win. And they'd be spending a lot of time in the hospital. But you have to give them some gap, and you have to make sure that they're operating safely as well. They have as much right to ride down that road safely as you do to get home safely as well. So, and then to go back with pedestrians. So I don't have any more visuals for pedestrians, just bicyclists. But for pedestrians, it's extremely simple. Follow the same general rules as you would with bicycles, except for walking. You want to walk facing the opposite, so you want to be facing traffic. Also with headphones, earphones, distractions such as cell phones, you don't want to add those into your walk. A lot of people will be running and walking with headphones in. I want to recommend just one, or have it at a volume that you can hear vehicles when they're coming. So the audio cues are huge when you're a pedestrian. Always stop, look, and listen. Right when we were 3-4 years old, when we started walking around roads. Stop, look, listen. Okay, visual cues and audio cues are huge. So if you take away that audio cue, or you take away that visual cue because you're looking at your phone, maybe, and listening to music, you're running the risk of possibly doing something risky. So again, walk on the facing traffic. Make sure you're staying within crosswalks, and always assume that the vehicles aren't going to see you when you're about to be crossing that crosswalk, or when they're approaching you you're walking along the shoulder and they're approaching you. Always assume that they're not going to see you, have a route of escape, and just be safe out there. All right? Any questions from anyone? I think this is my whole spiel.
I just have one. Short passing in a yellow lane or a double yellow lane to allow the 3 feet. Is that something that there's a grace? Because you see that all the time with our narrow roads in El Dorado County. They don't have a shoulder on them, and the bicyclist wants to ride in a safe position, which can be 2 feet or more from the edge of the pavement. Yeah. And you just don't have enough width to pass without going around them somehow for a brief period.
Yeah, so in those situations, you can pass them within 3 feet if you have a visual or an audible notification. So say you roll down your window, hey, can I pass you? Hopefully if he doesn't have, or she doesn't have headphones in, they can hear what you're asking. They can hear your engine. If they say, if they don't even say anything, but they give you a motion to go ahead, if they know you're there and they give you a motion to go ahead, you can pass within 3 feet. So you can get tighter than that 3 feet. So that's the recommendation that I can give.
So to be clear, because I think a lot of people don't understand it. So if you have a bicyclist on a road, on Bass Lake Road, where I'm at all the time, you just don't pass them. It's really what it comes down to, until there's a safe place to do it, or there's, I had a bicyclist, as I was stuck in traffic on Bass Lake Road, come up on me and rap on my window. I need 3 feet. He was a little belligerent. I've never seen that before, but the guy came up on me and then went past me, but let me know as he got up to me that he wanted the 3 feet. So whatever. And there are no shoulders on Bass Lake Road. So yeah, it's a little unnerving. I mean, there's no place for him to be.
Yeah, it's unfortunately it's a cultural issue that we've kind of stepped into as well.
Yeah, that's an element. Yeah,
people within the metal and glass bubbles of their vehicles feel very brave. People behind keyboards feel very brave.
Yeah.
Cyclists, when they have a mode of transportation that can get them away from somebody fast, feel very brave. But we need to understand that we need to be courteous and polite to everyone that we come and encounter with. Who knows what kind of day that person that you're going to be rapping on their window is going to be having that day. So Highway violence, road rage, as we want to call it, is a real thing, and it's a real thing that hurts people every day. So we want to make sure just turn down the temperature on the highways, whether you're a cyclist, pedestrian, or motorist, turn it way down. I'm begging you. We just want to make sure that you get home safe, and the person that you decide to pick on that day might be having the worst day of their life and make yours the worst day of your life. So let's just make sure that happens.
Questions or comments from anybody? Yeah, Chief, then we'll come over here.
Mo Johnson, Fire Chief, Eldorado Hills Fire Department. I think this conversation is very timely, and a lot of people will say that it won't happen to my kid or it won't happen in our neighborhood. I can tell you why it's just chilling to me that I have, right now, just reading, I got Friday, a family who had their son fall backwards, became son fall backwards off the longboard, struck his head on the ground, and he's alive today, but there was absolutely a time where they weren't sure that was. So we're working with them, putting a PSA together. I think that might be something we can work on, because I want them to be able to tell their story, share their story, and let everybody to see that my kid looks just like your kid, and if it can happen to them, it can happen to my kid. So I think that's something that is very timely. I appreciate you putting this forward, and we can't just keep saying this won't happen to us, because it's happening right now in our
There were two of those longboard accidents, I get within a week, and they both, nobody knew what was going to happen to that kid. The first day, nobody knew. And then the recovery, nobody knew what it was going to look like, thankfully. But it's devastating.
It is.
Thank you,
Like I
Chief.
said, it's just that simple helmet, and we're talking about a traumatic brain injury, not in their, in the middle of their life. We're talking about something right at the beginning of the
Right.
prime of their life.
That affects them for their whole life, yeah.
I'll get you so many boxes.
So Ron, go ahead, yeah.
All right, Ron Cassidy.
Yeah.
My question is on the e-bikes. Now, there's several shops in Folsom, a shop in Tahoe City that rent those for the day, for the hour. And you can't tell what type of bike it is. It's black, it's got a motor on it, and it zips you along the bike path that they have, along the lake there and along the American River here. I'm not sure, if it's legal to ride it on the bike trail or on that, as long as it doesn't go out onto the county city streets.
So those e-bikes is probably Folsom Bike that they're renting them from. Those are going to be up to class 3, which are legal, and they can be ridden on bike trails. And in fact, electronic scooters, unless the municipality has prohibited it, are allowed on bike trails as long as they're staying under 15 miles an hour. But yeah, that's encouraged, and we want that to happen. We want people to get out and about. We want people to use these facilities, spend their money, do all that great stuff. And that is what we're here for. And so we want to make sure that that's done safely, though. And we have a good working relationship with Folsom Bike. They help us out with our bicycle trainings that we have in Northern California, which are usually held in Folsom or Redding. They're a good organization, but we want to make sure that, if people are going too fast, we'll definitely do some enforcement. And I think specific bike trails do have specific speed limits. I think the American River Bike Trail, 15 miles an hour? And that's connected very closely to the Johnny Cash Trail. So yeah, that's a huge area. And for hit and runs, collisions on those things, we are investigating those crashes. Folsom Police is. We're aware, but for those, I'm pretty sure they're going to be under. No license required for those. So yeah.
We have online participants. We have 2.
We have
Rayona, just Rayona, looks like, yeah. Rayona, you have the floor. Just unmute your mic, please.
Okay, can you hear me, John?
Yes, fine, go ahead.
Okay, great. With regard to enforcement of the no helmets and the excessive speed or the inappropriate use of the bikes, scooters, et cetera, does the citation go to the child, and is there any fine associated with it? Or does it elevate to the parents and then it actually gets some enforcement?
So the CHP has a program with parental notification tickets. When we're talking about children with bicycles, it will likely fall in that realm. Parental notification tickets are tracked, and then if there's multiple violations, they do go beyond it's basically a letter to the parent from the command. Then it does go beyond that to fines and going to court with your parent. It's not necessarily one of the first steps that we want to take, but can it happen first step? Yes, a ticket and a fine in court with your parent. But typically we're just going to be going to parental notification first. I'd like actually to do a verbal contact with the child first because I want to build a rapport with them to know who I am if I'm out there more often, that I care. And if somebody shows that they care, especially a figure in authority, it might go a longer way than a ticket. A ticket could maybe go the opposite way depending on the circumstances for a 12-year-old. So we want to make sure that we're building that relationship, that we care for them. For example, just last Wednesday or 2 Wednesdays ago, me and one of my senior volunteers, we were driving up El Dorado Hills Boulevard. We saw a kid that his bike broke. One of the pedals broke off of his bike. So he had to be at school in like 20 minutes, but he's not going to get there to Silva Valley Elementary walking. So, hey, guess what's going on my push bumper, a bike, and he's going in the front seat, and we're going to make that happen. So those kind of the relationships that I want to build. I don't want to really be writing tickets to 12-year-olds. That's really not why I signed up. But the enforcement may need to start taking place. We'll see.
Okay, thank you.
Yeah.
Thank you, Rayona. Yeah, there's a big topic here. We could go on and on and on. And I think probably there's 100 questions that can be asked and stuff, but really appreciate just kind of the summary presentation here of where we are. Because like you said, this is a trend that's occurring and it's going to accelerate in terms of the demand for these kind of vehicles, e-bikes, scooters, et cetera, because everybody's going to look for something that's less expensive to get from point A to point B than gasoline or diesel in their vehicle. And this is one of the answers a lot of people have found, in addition to the Teslas. But
well, $58,000 for a car.
Yeah, right.
Or $2,000 for a very high-end scooter.
Right. And so parents will tend to think, okay, I'll just get that for my kid and they can ride to do whatever and I don't have to take them to practice and this, but unfortunately that's not the law in California. So this was a good awareness thing. And I do think the public safety notification, advisory, that type of thing would be helpful as well. But ultimately it comes down to people trying to encourage other people to do the right thing. And I don't think you want us calling 911 if we see a kid on a scooter doing 30 miles an hour without a helmet. But if we get an opportunity to talk to them and encourage them to understand what the law is without being forceful or anything, maybe that's helpful. But yeah, and we have pamphlets that I'd love to get out to some schools. So if there's anyone that has any ends with schools, my email is anbrown@chp.ca.gov. So AN, first two letters of Andrew, brown@chp.ca.gov. Shoot me an email. I'd love to get into schools, do presentations. We do bicycle rodeos. That's kind of one of the neater things that we do. And bicycle training. We have tools that we can do maintenance on bicycles. Say if a child shows up that it's not fitting the bare minimums, we'll do some torquing on it and pump up a tire or two and patch something. Make sure that they leave with something better than they came with, and at least a helmet that works better than what they came with. Yeah, this is some pretty neat stuff. So we're going to be doing those during the county fair at least once a day. And then also, like I said, during El Dorado Hills 4th of July for a local event, or 2nd of July. 2nd of July,
Yep.
right. Thank you, Officer Brown. Appreciate the presentation. Excellent job. And so we'll give you some feedback. And we do have contacts with the Office of Education and the school districts and stuff, but I think that's an important message to get to them. So we will try to make sure that that gets distributed and the offers there for the CHP, yourself or someone else to come in and make a presentation, because that's where it starts, is education, letting the kids know these things early, and the parents as well. Hopefully we'll learn from that. But okay, so moving on, let's go to item 4, supervisor communications, and he's going to be very quick. We did have our second special meeting for the community council on the mental health forum. Had a lot of good dialogue. It's out as a video on YouTube, and we've sent out notifications to people on the email distribution list that we have. We've gotten some responses back. But that conversation it's been an initiative to get Marshall Hospital in particular talking more with Sutter Hospital about some of the programs that they've had and how they might be adopted in the county, and it's been very well received. So that conversation, so to speak, has gotten started at a level that I think we could see some significant benefits from in the next year or so. So very helpful. I think people are appreciative. We are going to do a third one that we'll be announcing before too long here, because there's some other service providers that I want to make sure involved and have an opportunity to speak relative to the mental health situation. But there's more and more articles coming out on it all the time. So when we get under healthy communities, I'm going to mention some of that. So I'm not going to belabor it at this point. The second thing is I did want to just mention that the chamber did conduct their business walk. Cindy and I went out together, but their supervisor Turnbull and 2 of his assistants walked. We had, I think it was 3 or 4 county employees who also walked. The manager for economic development walked. Our director of planning and building walked. So they were able to interact with some of the local business owners and gather information and stuff. And I think everybody felt it was a worthwhile endeavor. And then the reports are going to start coming back in terms of the summary of the information that was identified in the survey. There's 4 questions in the survey. So we'll be able to share that once the chamber has released that information. And then I think there's some follow-up activities that have to happen as well, because sometimes there's a need to go back and talk to a specific business by that chamber to assess the situation that the chamber may be able to help with some marketing, some support, whatever it is. The 911 is what they refer to it as. So if we found a business that was really struggling to try to keep the doors open, that was one of the things we were supposed to convey. And Cindy and I didn't come across any of those. Most of the businesses that we talked to were doing well. They were either doing better than when COVID started, or they were recovering, or it was about the same as during the COVID period, pre-COVID, COVID, and post-COVID were kind of the questions, the segments of the questionnaire that were asked to the businesses. But we'll get more information to everybody on what those results are as they become available to us. And so that kind of covers the supervisor communications. Are any questions on any of that? Pretty quick. We'll give you more information in the future. So, all right, seeing none, then let's move on to our leadership team progress reports. And Officer Brown, we're going to start with you again.
So the Highway Patrol, we're still continuing on with our regional campaign against impaired driving. We just had our second quarter meeting regarding that here in this facility. That is proceeding swimmingly. We're seeing some statistical results from those enforcements that we've been adding to our patrols. I want to just give a pitch, which I didn't give during my presentation, but basically during every single presentation, I think I spoke to somebody about every single thing that we do is going to have to do with recruiting right now. The Highway Patrol is aiming to add 1,000 officers to the patrol within the next 2 years. And that's just a very hard thing to do right now. As you can imagine, within all public agencies are having difficulty recruiting career-oriented persons that want to work 30 to 37 years at a single place. For the Highway Patrol, it's not necessarily single place. We want to recruit from all across the state, but we have exceptional benefits, exceptional pay, and exceptional work conditions that you can't get anywhere else. And again, if anyone that you know that is half interested in going into law enforcement or public service, give the Highway Patrol a look. You can go to CHP career, chpmadeformore.com. That'll give you a lot of insight into where we're going as a department and how we're recruiting, and we want to recruit you. Our minimum requirements are very basic and minimum. Obviously, it's a highly competitive job nonetheless. During the application process, our age requirements, you have to be 21 by the time you graduate and walk the stage, and you can't apply if you're 36 or older, unless you have a military waiver before your 36th birthday. But that's kind of a more unique situation. You can defer if you're active duty military for 8 years. So that's 35 plus 8. So that's as old as you can get to be a Highway Patrol officer coming out of the academy. So we are recruiting like crazy. If you have anyone, shoot them my email that I gave earlier, anbrown@chp.ca.gov, or you can call our office, or you can call Valley Division Recruiting. We are desperate right now. We're doing everything we can. We're pulling out all the stops. So anything that we can do to make you want to become a highway patrol officer, maybe not anyone in this room, I don't want to assume anything regarding age, but sorry, Mo. Your friends and acquaintances that maybe are looking at law enforcement or public service, the highway patrol wants them real bad. So give me a call and we can talk about it. Maybe set up some ride-alongs if they're recruitable candidates, and we'll go from there. But that's about it. That's all I got for today's report. Thank you.
Very good. Thank you. I don't think we have anybody from the Sheriff's Department this evening. I didn't see anybody in the Zoom aspect, and nobody's present here. So let's move on to our fire service report. Yes.
Yeah, a lot of great stuff going on in the fire department. As the weather's starting to get warmer, and as we've had just such little rain this year, I think fire season readiness is one of our top priorities. So the crews are out training as you would expect and getting ready and just being in tune to the fact that the fire starts are already occurring in the county. So a big focus for us. And along with that then is the prevention aspect. And I know we talked about last month, the vacant lot and our defensible space inspection programs are both up and running. Our board took some action today to even move those forward even more, and our inspectors will be out throughout the community and beyond just the El Dorado Hills boundary working on that. We also have a lot of recruitment going on. We're currently recruiting for firefighter. We have several candidates. Hopefully we'll pick up a few people. We're still figuring out the number, but that's a great thing. We also have promotional tests going on for our engineers, our captains, our battalion chiefs. So a lot of great activity. You'll see tractors sitting down at the training center site. And Chief, do you want to jump in on any topics? I know you might have a couple additions you want to make, but really a great time for us and a lot of excitement going on.
There is actually equipment down at the training site. I was just there earlier, and so
excellent.
Beer Camp's not wasting any time getting some equipment out there. Really just one big item, one small one. I'll start with the big one, not the greatest news. However, today's special board meeting, the EDH Fire Board voted to rescind the letter of intent to annex Rescue Fire Department, and they also voted to terminate the shared services contract. As many of you may know, we've been in a shared services agreement with the Rescue Fire Department for almost 9 years, actually right at 9 years now. So we've managed that department in totality for some time now, but at the end of the day, we want them to be able to find what it is that they want. We just can't commit the time that they want, given it's a one-station department, and we've got other priorities here in El Dorado Hills. And there's also, time, energy, effort, and quite honestly, funding that's also associated with trying to run another department as a separate department. So we're going to remain great partners with Rescue. We'll support them in any way that we can, but we are working to transition out of that relationship. So I just want to give you a heads up on that. Thank you.
Thank you, Chief. Okay, so I think we've finished with our public safety reports. So let's move on to economic development. Glenn.
Turn that on. Okay. Not a lot new going on in economic development. EDH 52, which is where Costco is, as we mentioned earlier, is kind of waiting on some applications from them, which will be later in the year, I guess. The Aloft Hotel in Town Center by the movie theaters has started construction or moving dirt, and that continues. There's still a lot of inquiries going through economic development and activity in the business park. And the ARPA nonprofit, the American Rescue Program, that is going through economic development at the county. They have sent out letters to all of the applicants, letting them know if they were granted or not granted a grant for better. So that's the latest update on that. So that's about the only new thing going on that I know of. Montana Center South, they were breaking ground too, I believe, right?
I don't know that they've broken ground yet. They're in the process. I'm not sure if they have a groundbreaking dates yet, but yeah.
And there's still ongoing discussion, but I don't think we've seen a lot of changes.
The business park has probably got more activities, but that's in District 2, so I don't want to get too far afield in terms of talking about stuff in the business park. But clearly from a Cdac perspective, those are the things that are of interest in terms of what kind of new businesses are being attracted, what kind of employment might they bring, all those things. And I think there will be some near-term announcements made to some of that that's going on that is different than what we've heard in the past, either at Apac meeting or someplace else, but all subject to change still, nothing definitive. But I do think that's one area that we're going to see some things within the next, I'm going to say 6 months, come out that are different than what was originally planned. And so we'll adjust accordingly.
And as economic development finalizes their 2022 plan, my personal emphasis right now is focusing on our youth, focusing on employment opportunities for keeping them. We've had an ongoing emphasis for a number of years of continuing education, junior college, four-year college. But we still keep coming back to the vocational, and we're seeing these jobs being created are not necessarily jobs that require a college education, even though a college education is still good for people in general. But we are seeing these jobs that don't require that education, but the kids aren't getting the skills here. So vocational education through the high school district, I think, is going to be very important. And that's my commitment to economic development, to our committee, to see what we can do with that.
You know, at tomorrow's board meeting, there's a recommendation for an at-large member of Cdac to join, which I understand she's associated with the Fair Board. So I view that as favorable, hopefully. And I understand that, you know, Don Ashton has had a discussion with the individual relative to things that might come from Cdac as a recommendation to the board, that they probably need to recuse themselves on that because of the direct association. But I think overall, I think that's a good addition. And so those things are obviously determined by the Cdac committee themselves, because it's not appointment by the districts. It's a at-large membership. So, but that is on the agenda tomorrow for approval as part of the consent calendar. So I don't anticipate an issue with that. So I think that's going to move on.
This next Cdac meeting is April 14th. So we will have our new member, and people can join by Zoom. And it's always published on Supervisor Heidel's webpage with a link to the Community and Economic Development Advisory Committee.
Very good. Yes.
Is anyone from the public education industry in the county ever engaged with Cdac in terms of schools and their curriculum, et cetera?
There was some discussion a couple of years ago with Cdac, but it definitely needs to be brought back and readdressed. But there has been some, and actually the county has some very good programs that are non-four-year college driven for students. There are a lot of programs.
When you say the county, I don't know who that is.
The county education, high school, El Dorado.
Yeah.
County Office of Education.
Yeah, Office of Education.
And that's implemented through the high school?
That's the.
Right now, that's the only thing the county's working with, is those kinds of ROP programs, or whatever you want to call them, that are occupational training for kids who may not be college bound, to get exposure to a particular type of trade or whatever. There was a long discussion at Cdac relative to, should we be looking to try to acquire a four-year type of university state satellite campus type of thing, and UC Davis was mentioned. There was a lot of research done over the years that didn't come to fruition. It probably doesn't seem viable at this point, but there's always new people coming forward with additional ideas for educational facilities. I know there's one that's being talked about. It's just on the Sacramento County side of the border, which might go forward. It might not, but as those things come up, they typically are brought forward by someone who's interested in bringing that kind of a unique higher education, vocational training, whatever, to the county or an adjacent area. It's typically Cdac, except with the exception of in the past of trying to look for, you know, is there a way to connect with a four-year type of university to bring a satellite campus? That's been their role typically, but that doesn't say they can't change. But there's definitely a strong need that's recognized for that kind of career training for people who are not college bound, to get good vocational skills that, you know, pay really good wages. So
Placer County is doing a really good job with education beyond high school. They're getting a Sac State satellite campus, which would be in the future. a full campus for another state university. They're also getting a private, Hillsdale has committed and looks like they will go through
Hillsdale College,
with
yeah.
a big campus. So we're chasing the wrong dog, in my opinion. And I think it's important to look at more vocational programs. I know the high schools have a lot of STEM type programs, but we've kind of moved away from plumbing, construction, you know, electricians,
right?
And they do have to leave the county for those programs. So,
well, we need a few plumbers who are superintendents of schools.
There you go. Placer County, I just mentioned, the attraction is to the cities, the larger cities. That's where they operate the campuses. The largest city in El Dorado County is South Lake Tahoe.
And they have a 4-year
The only
program.
other one is Placerville, and they have a good program up there. They have a 4-year university. You can get a 4-year credential from the community college up there. It's not, it's more, it's got a different name, but it's a 4-year, certain degrees are offered as a 4-year curriculum.
You can live in Tahoe and get a bachelor's degree.
If you can live in Tahoe, but yes.
El Dorado Hills not being a city, doesn't seem to be much of an attraction to work in this area right now. That's my opinion. There could be if that changes, but they generally want that support because it's an additional funding stream that will support an educational thing beyond what our county can do. Placer County's got a lot more resources than we do on a per capita basis. It's just the facts. So, but good thought.
Sacramento has, what's the Davis program? Something Square that the Aggies.
Oh, Aggie Square.
Aggie Square. That's going to be a big redevelopment education hub too. But it still has there's still a lot of opportunity for the typical trade type school occupations in this county, and it's going to continue. And that's the jobs that we're seeing come to our county.
Yep. Any other questions for Glenn? All right, let's move on to infrastructure. John Vania is actually in long cross-country travel, so I just wanted to bring up the planned closure of Silva Valley Road, and I've got Raphael here still, so he can give us more of the specifics, but we were consulted from Raphael, both John and myself, relative to the need for major sewer line improvements on Silva Valley Road, very near the Highway 50 intersection. This would be on the north side. So between basically where Oak Meadow School is to Highway 50. And so they're talking about detours that are all planned out. But the question was whether to basically take a 2 to 3 week type of shut it all down, get the work done, or do it in phases. And so our recommendation, both John and I, back to DOT, was shut it down and get it done, because when you do a little bit and then come back later and do a little bit, people tend to get more annoyed than if you just shut it down and do it in one series. So, Raphael, are you still there?
Yes, I am.
Can you help me with the timing? I know we suggested that not occur until school is out. All the school systems are out, so we don't have that conflict with parents trying to get kids one place or another. So do you have a time frame for us you can share?
That is correct. It will be starting in early June. We are currently working with the development that is installing the sewer line to coordinate with the El Dorado County school system to make sure that it is during that time period in which school is going to be out. It was either going to be a 4-month construction schedule with just partial closures, or a 4-week time frame with a full closure of just the southbound Silva Valley between Clarksville Crossing and Tong, just there, that portion that is in front of EDH, just before the interchange. And as you said, we felt it was a better alternative to just hurry up, get it in, and get them out. And because of Clarksville Crossing being adjacent to that and parallel to that closure, it was going to be providing the parallel access for somebody to make an easy detour around the construction zone without too much of a delay.
Yeah, thank you. I think the detour routing is pretty good with the Clarksville Crossing intersection coming around, so we can make work of that. But anybody that has to do it on a daily basis is going to get a little annoyed. That's just the way people are these days, because you've added a little bit more time to their their schedule but those kinds of improvements need to happen. And I think it's better just to get it done, as we said. So that's just kind of a public information item so that you're aware that's coming.
And just so you know,
Yes.
they are anticipating this closure to be this coming June. And so if there are any changes and or any updates, we will be notifying this group as well as putting out a public outreach flyer, just so that it is well announced, as well as possible changeable message signs well ahead of the closure, so that everybody in the community is aware.
Thank you for that.
Okay.
Any questions on infrastructure? Yeah, Tim?
The big if, but if EH 52 Costco goes in, will this additional sewer line coverage be able to accommodate whatever sewage line needs those developments might need?
Raphael, can you answer that? I can't, so.
I couldn't hear the question. Can you repeat it?
He's saying,
Supervisor?
is the added capacity in the sewer line being put in going to be adequate if Costco does come in, that we don't have to tear the road up again to make further expansions, because now we have a new project that requires more capacity?
Definitely. We definitely wouldn't want to have to do this exercise twice. We are making sure that they are going to put a stub out, so that if in the event there is a future development there, whether it's Costco or anybody else, that we'll be prepared.
Okay. He gave me some information on the size of the line, 14 feet below the ground. I mean, this is a big increase in capacity. So you would think EID would plan that for, the next 25 years, but, well, you would think. That's, yeah, you're right. You're right.
That's also some very hard digging.
Yes, that's going to be probably maybe even some blasting in some of those areas.
Yes,
There's some
John Davis is correct. That is extremely hard terrain that is in there, and which is the reason why just that short distance is taking so long, because of the rock that it is at that location.
Yep. All right. So not seeing any other questions. Let's move on to good governance. And I have one item. I'm going to cover the letter to John. But Richard, anything you have?
I defer to you.
Okay. So I just want to make sure, to me, it's good governance when you find the ability to go ahead and support a project that's increasing our capacity for parents' choice and education of their kids. And that's the way both Supervisor Turnbull and I look at the proposed expansion of John Adams Academy down the business park. They're currently in one building. They've made a proposal to basically purchase and use a building that's horizontally opposite the street. It's not across the street, but it's kind of a horizontal configuration. That
Parking lot across the parking lot, yeah.
It's across the parking lot, so it's really within the same pod or whatever you want to call it. It's the same immediate area, but it's not immediately adjacent. It's kind of horizontally across. So both Supervisor Turnbull and I visited the university down there, the campus, went through some of the classes, showed with the kids in there and the instructions, and both of us felt that it was such a well-run program from the standpoint of each individual child sometimes has unique needs, and there's no one education system that can provide all those needs without some sort of variety of the way they do the presentations and teaching. John Adams seems to have a very workable situation. They've got 100% waitlisted kids to get into the program compared to the ones they have currently enrolled. So it's not just El Dorado Hills. Obviously, it's El Dorado County, it's Placer County, it's Sacramento County, it's the whole region.
And Commissioner Nevis is attending here virtually, but
Yes.
the Taxpayers Association this morning had them as a guest, John Adams, and to discuss that. And, it's when you think about where they're pulling kids from, it's not just El Dorado County, Ranch Grove, or Folsom. It's Woodland, it's Fairfield.
Yeah.
It's significant. There's a demand. So yeah, it's a unique school, and I think it meets a need here that people have identified that they want for their kids. So.
Yep. They're sponsored by the El Dorado County Office of Education, not a specific school district. So that makes them an independent charter school. And so they get limited fundings compared to some of the other limited funding from the state compared to other charter schools, et cetera. But the bottom line is the Office of Education did an analysis. They looked at what are the impacts to local school districts in terms of the potential for loss of students from the local schools into John Adams Academy. And the largest one locally I saw was 98 kids or something or other. But generally, it's very low impact to the schools, but there is a concern by school administrators locally here that they're losing, you know, the certain level of students, and then obviously the daily associated money that goes with it, which pays for teacher salaries and all those things. So there is some conflicting interests involved with it. Both Supervisor Turnbull and I felt it was important enough to write a letter of support after having reviewed it and looked at the analysis that was done. And I plan on attending the meeting either in person or Zoom to give them our formal recommendation from the county. So there's no Zoom for that? Okay. Okay. Because I was supposed to get all that information. I haven't seen it yet. So, okay. Okay. All right. So we'll have to be there in person, I guess. So I have to try to make sure that works. But that to me is good governance. When you see a need in the community and it supports parents and parents' choice for education, it just seemed like it was the right thing to do. So that's why I stuck it there in terms of letting people know that at least two of us on the board have taken a position on it, since it directly affects our school districts probably more than the others, you know, those within District 1 and District 2. So with that, back to you, Richard. Anything else you'd like to add?
Question though, whose permission do they need to expand?
The Office of Education Board, which there's 5 members on that, need to approve this. Staff is in this report, which including the appendix, I think is like 68 pages. They did a very thorough analysis, in my opinion. Staff recommends that they go ahead. There was a challenge from a legal perspective as what is the written language relative to expansion, and does it have to be within the same footprint? Can it really be a separate building? And the analysis went through and responded to each of those things and basically said they found it compliant with state law. And so there was no restriction on what John Adams was proposing as being, you know, outside the boundaries of the charter provisions that the state has established. So,
And I think it's a little unique situation too, because I think technically one or both of those properties are not in a specific school district here. It's in Latrobe. An element of their campus. Because when they first came here, they were talking about being next to Blue Shield.
right.
Are we okay to say the district? Can we say the district? It's a certain school district here, and what they're at now physically, which is why, and that district did not favor that, but they went to the Office of Education because they technically were outside the boundary, inside the business park there, and that's why that's the business park and a lot of senior development over there, because Latrobe School District could not handle a significant increase in kids. So that, I think that was part of the discussion this morning that I'd heard.
School districts don't consider necessarily business parks as ideal locations for schools, right? Which makes sense. So anyway, there's that ongoing discussion, but ultimately the Office of Education, 5-member board of trustees will make the decision, and it'll either be an agreement with staff's recommendation to allow the expansion or not. So that will be determined at that point. And that meeting is, again.
Tomorrow at noon, 12:30.
Jeez, okay. Ed was supposed to give me all that information. So, okay, so I'm not going to be able to attend because we have a board meeting tomorrow at noon. So unfortunately, that's just the way it's going to work. It'll just stand as a written letter. So, okay.
Working with District 2, trying to get, because people were trying to get their public comment to them. We're having some difficulty with that.
All right. So let's move on to, yes, go ahead. Sorry.
Just wondering, every time we have a development in the county, El Dorado Hills specifically, Apac gets involved, the community council gets involved. We always look at traffic implications. So new development, new resident development, daily trips, stuff like that. New commercial development, Costco, ED 852, up the hill off Bass Lake Road. How many daily trips? What's going to do to the traffic? I know school districts have a different. They don't have to care about traffic, but is any study, or does anyone take a look at how many additional daily trips at commute hour times? Between 7:30 and 8:30, I assume the school start is, and between 2:30 and 3:30, school exit. What additional burden will that put on White Rock, Latrobe area? Has anyone even looked at that or considered that? Because that's something that we have to address with every other development.
Oh, it doesn't look like Raphael is still with us unless I'm missing something.
I know this morning they talked about next year the law changes in terms of start times for high schools. And they were talking about having one group of students starting at 9 a.m., which is technically after the commute, in an effort to break up, because their access really is a driveway into a parking lot in the business park. And their connectivity between the buildings is the parking lot. They'll have to make it, and they want to eventually have a sports field. They have a little bit of a sports field there now, but they want to buy another piece of property to connect on the outside of it. But they said that the start time would be their initial effort to mitigate against any sort of significant traffic.
Traffic offsets, yeah.
Yeah. So, yeah, but you're right. The state controls the schools.
Yeah, the only thing the county has any control over relative to proposed school sites or anything is road encroachments, You're either going to get an encroachment or not, and that's the only thing that we have. So even when the state proposes a new elementary school along a major corridor like Silva Valley Parkway or something, we have no ability to influence that based upon a traffic study. That's the state. They basically exempt from any kind of a CEQA requirement, as I understand it. They just proceed with their internal planning and it happens. So kind of a unique situation.
The concern is going to be, it's just going to be on the road. Parents are going to be dropping their kids off.
Yeah.
If this expands, they're going to double the size, or I don't know what it's going to go.
I think they have 800 now.
Yeah, they have roughly 800 now, and it
They're
probably
talking about
won't double
doubling.
the size, but because they need more space, they're already cramped in closets and stuff. But I'm guessing it'll be a 50% type of increase in enrollment, because each year they've gone through and added another class, and I think right now they're up through 12th grade. No, 10th grade. I think they're 10th grade or something now, and then they're going to go to 11th, and they're going to go to 12th. So as that progression of a given class moves up the line, they need more and more teachers and space. And so that's one of the reasons for increasing the footprint. But the other major part is they're just cramped right now. There isn't enough space to really run the program they want to run with the existing students. And they need just to have more space. And there isn't any more space within that one building, so they have to go somewhere else. But it's within the immediate, and there is a roadway you have to cross to get to it. So it's not just walking across the parking lot. There is a safety consideration relative to getting one side of the road to the other, but that's what crosswalks are for, right? So, and the parents will be dropping their kids off in a different parking lot if they have school in the new building as opposed to the existing building. So, yeah. Skateboards, they'll be flying across the road. Yeah.
But that we did we had the superintendent from the high school district come and talk to us, because we always have that question at Apac on new projects suggested. The feedback from the schools, go ahead. And I think largely our assessment is because as they're getting a per student fee, they're getting an impact fee, and that's dollars.
Yeah.
And the discussion we had, I think it was 3 years ago, was that enrollment overall is declining in our high school district, and that's the projection that they have. I think Oak Ridge was projected to keep increasing for a few more years and start declining. Mm-hmm. I've had discussions after that saying that's not entirely true, but the other high schools are declining. So, but when we talk about projects, and it is a state impact, and and then they're pretty hands off with the road part of it for us. But why can't we have an analysis of our own saying, well, you're generating this, developer, for this project, anticipate this sort of student increase. Maybe there should be an analysis that's independent of what the school would provide or mitigate, that maybe what we take into consideration. But oh well.
Okay, any other comments on that item? All right, then I'm going to skip down and ask for the APAC report, and then we'll do community information and outreach, and then I'll kind of wrap up with healthy communities. So.
Okay. We are having our meeting here next week on Wednesday, the 13th, 6:30 p.m. It will be both a hybrid meeting like this one, where it's in person or virtual via Zoom. We're looking at a couple very specific things. Something that's come up recently that's going to be at the Planning Commission on the 14th, which is the Summerbrook. It's a tentative subdivision map revision. They're requesting eliminating condition of approval for a traffic signal at Green Valley Road and Deer Valley Road, the western Deer Valley Road, not the one further up in Rescue. And, I know that APAC, we had a subcommittee back in 2014 provide some impact.
Does everybody know where he's talking about? Pleasant Valley School across the street?
Right
the
across
new
where they're putting in
subdivision?
29 homes right now.
Yeah.
So they have a condition of approval that they have to finish the intersection improvements, which are largely done, but were completed by the Silver Springs development, but also to put in the traffic signal. And they were told by county staff in 2018, but it was part of the Dixon Ranch analysis that traffic warrant does not exist anymore for a traffic signal right now or in the time frame of their project right now. So we're a little concerned because it seems to be a lot of asking for conditions of approvals from 10, 14, 20, 30 years ago, that the reality that in the analysis now is that it's not what they thought it was going to be. So they're asking to eliminate, I think they've spent about $12,000 to $17,000 on analysis and design of what that would look like, and they just want to make that their contribution to the traffic signal that some future developer will finish. It's always, what we're hearing, it'll be somebody down the line that will handle it. So we want to look at it because it is in rescue. It's not in El Dorado Hills, and I believe the plans say it's Cameron Park, but it's in rescue. We had a subcommittee. We have a subcommittee member from that year sitting right next to me that looked at that and said, hey, you know what?
2014 or some crazy year?
Yeah, right. When we did the Green Valley Road study, the corridor study analysis, and the feedback from the subcommittee members was, hey, we need you to adhere to what, these concerns are with the Green Valley, analysis. So, and so it was conditional support based on the fact that we're going to do that signal. So they don't want to do the signal. It'll be at the Planning Commission the day after our meeting. So we don't have a lot of time to have any sort of thoughtful or informative conversation about it. However, I did ask Director Martinez, could somebody come and speak about it? Just to educate us about why is this happening where our analysis from 10 or 15 years ago, or 7 years ago, or 40 years ago, why do they seem to be wrong? The reality is different now. And nobody's 100% perfect. You can't read the future. We're not saying that this is some egregious error, but we're concerned. The community expects these things to be improved. So Adam Bain, he's a senior civil engineer in the Department of Transportation. Adam has volunteered to come and talk to us, to give us a little bit more information. We'll probably have our comments into the Planning Commission before that based off of the old information, but we will do that. And then we'll discuss that. It'll be educational and informative for the community to see why things change, right? You can change a condition of approval, a decade later. We'll also be talking about two projects that are sort of combined. There's a TAC meeting on April 11th that apparently we're not invited to anymore, but it's for a quick crack car wash on Green Valley Road at Sophia Parkway. And it'll be next to the EDH Folsom self-storage, the lot next to it, which is a separate project, but it's the same developer, it's the same team. We're going to talk about that, just to let the community know what it is. It's a TAC meeting for conditional use permit. So there's not a lot of feedback we usually give on the conditional use permits, but that's to be on the 11th. So we'll have an idea of how that turned out, although I don't think we'll see anything in writing unless we can get someone to get it to us. But also, in addition to that, EDH Sophia Parkway Neighborhood Retail Center Development Plan. So the hook rack will be in this development. They just submitted their project application, I want to say on the 30th, and they finally posted it on the 31st. So it's informational, it's very early in this, but they're talking about 4 buildings, a proposed restaurant, a proposed multi-use commercial, Smog and auto repair shop, and at one point the owners of Smog King owned the property, or they had it partial ownership. So they had talked about moving across the street from across from the Purple Place, and then the car wash, the quick quack, I can't talk. At one point they had talked about many years ago, perhaps having a drive-through restaurant there, but now it looks like it says standalone restaurant. It doesn't say there's a drive-through, and the drawings don't show it. We'll talk about that as well. And then the very last thing we'll talk about is that Supervisor Heidel mentioned earlier in his comments, and Hillary had asked about, the Central El Dorado Hills specific plan will be coming to the Planning Commission April 28th. It's an opportunity. The way it was described to me by the Planning Commissioners was that it's an update for the Planning Commissioners, considering that 3 or technically 4 Planning Commissioners have never sat down before this project when we had the 3 previous hearings, including the one here in El Dorado Hill in 2020, right before we all stayed home for a long time. So it's an opportunity to update them, but it's also an update of what the plan has changed. And we still don't know what the plan is. It's supposed to be the same plan, but there are elements that are changing in terms of circulation. So we won't be able to make any sort of educated or informative comments about the plan until we see it, and they don't come out until 2 weeks before the meeting. The meeting, is later in April. We'll see if we can glean something from that. But we also have some information from a local resident, a retired developer, had a lot of hands. He did a lot of land acquisition, financing plans, facility financing plans for utilities and many different elements. He's provided some information to us, and we'll just share a bit of that and talk about it and get people ready when we come back to the Central El Dorado Hill specific plan. And then, as Supervisor Heidel said, May 12th, the first commissioner meeting for the Planning Commission on May 12th is supposed to be their deliberative meeting, the hearing where they decide whether, what sort of support, non-support changes that they're going to recommend, and then pass it on to the Board of Supervisors. So it's a lot to take in a 2-week period. We haven't talked about it since last summer, if I'm remembering right, June, I think. And we still don't know really what the changes are. And I think I made this comment to a planning commissioner, was that, when the golf course closed, my kid was 2 years old. My kid's going to college next year. So it's a long process, and there's been a lot of dynamic changes, but that's what it's supposed to be. It's about understanding what the impacts are and making it a better project. So we'll hear about that. And everyone's invited to attend. Love to see you in person. If you can't, then virtual is fine as well. So, and if you had anything you want to add to it? I know you do.
I comment on all of them. I think what I want to comment is on the signalization and the request for change of approval, Deer Valley and Green Valley. I responded to your email yesterday.
Yeah.
Copied all the other people who copied on it. I've since found out that the cost of a signalization is $400,000 to $800,000 to signalize an intersection and provide for the annual maintenance that's required to keep it going. When a developer, 16 years after his approval is granted, wants to come back and say, oh, by the way, I want to get rid of this condition because county transportation says it's no longer needed. And oh, by the way, it's going to save me $400,000 to $800,000. I don't think the county should just say, here, go ahead. It's a one-way street. We're going to save you a lot of money. The county should require, if they can request an amendment to a condition of approval, the county should be able to open it up and say, maybe there's additional conditions of approval that are warranted now.
Or could be modified.
16 years ago, but has time to change. You want it to change, the developer wants to change a condition of approval from 16 years ago, the county should be able to open it up and also say, maybe additional changes of condition of approval are needed now to reflect the current time. I don't like the idea of the county saying, okay, well, our Department of Transportation says we no longer need it. Okay, we'll take that condition of approval away. Developer, we just saved you $400,000 to $800,000. Make the developer contribute some money to the unfunded or underfunded Department of Transportation road repairs, maintenance, new projects that we all know are underfunded and are already severely delayed. So I'm making more of a statement.
Yeah.
Supervisor Heidel, it's more maybe for your ears.
Yeah, I understand.
I expressed it in the email. You kind of get what I said this before on other projects. We just keep following the same path. We keep going down the wrong way, in my opinion, and we get nothing back.
Yeah, and or before. My understanding was that most of the signalized intersections here, especially with 4, it's about $1 million. It's like 800 to $1 million. So it's not insignificant. They're pretty expensive homes that will be going in there. And it's a different developer. They bought the property like we had talked about last year, and they knew the conditions, but they probably also had the information that the warrant had suggested in 2018 that it wasn't needed. So it might have been an enticement.
They spent $12,000 to $17,000. That's their contribution. That's no longer needed. We also know there's another big project that's at least proposed on Green Valley, about 500 homes, and they're going to want to pass that one down. It's time that they all have to share it. They can't keep taking down the road because the road does end. There's no development. None of these improvements will
county's gonna rethink how it analyzes and looks at this. That's just my opinion.
It was the Tim and John show. Thanks for stopping by.
I understand. So I will just mention, tomorrow's board meeting has the release by the board for the town center, new traffic signalization at Post Street. Accepting it with the exception of a holdback. I think it's $400,000 or something, but accepting the developer's donation of that. That's outside DOT's domain. We couldn't require it. We requested they put it in. They put it in. I think from my experience, it's a great improvement. Some people don't like it evidently, but that's the state of anything you change. Some people don't like it. But it seems to me like the flow is much better and it's much safer environment because you're not looking at all these cars trying to figure out who's in a hurry is going to jump in front of you. You either have a red light or you have a green light. And I think that's a big improvement for that busy intersection, but.
That was one of the things, we did not support that project, but one of the things we asked for was a signalized intersection.
Right.
It's a private road. So that was the one plus that we could see with that project. The reality is that the in and out of that private road is troublesome too, with people trying to do this, coming off Latrobe, trying to get into the right lane to turn left to go to the marketplace, to go straight to go to further into town center.
It's too short a distance off of Latrobe
Yeah,
Road. There isn't enough setback off of Latrobe Road to make
Can we
that
move
work
that?
real well.
Can we move it? We can't do that. So.
Not without a total redesign of town center. I don't think that's going to happen, but maybe someday.
Yeah.
Okay, anything else from APAC?
I hope not.
Okay, all right. Cindy, you're on.
Okay, well, it's exciting. We have some Easter events coming up. First off, this weekend, April 9th, it's Baskets and Bunnies at El Dorado Hills Town Center. They're going to be having music, games, prizes, magic shows. All kids 12 and under will get an Easter basket that they can decorate. And they're going to have it at 2 locations, so it's not a big crowd and all in one. So they're going to have it at the Stephen Young Amphitheater and also the Theater Plaza next to Mimosa House. So that is this April 9th from 10 to noon. And then from April 9th through the 17th, the California Welcome Center in Town Center, they're going to be having photos for Easter Bunny. For anybody that wants to go do that. The El Dorado Hills CSD on April 16th, they're going to have Easter egg hunts at a lot of the park locations at Community Park, Promontory, Lake Forest, Bass Lake, Selwood Field, and Valley View, and that's at 9 a.m. sharp. So they're going to have, they used to, I think, have it just at the main
Community Park,
Community Park, but they're going to have it a lot of different places. So not a high concentration of people at each location. So. And that's April 16th. And also on April 16th, the CSD is also going to be doing pictures with the Easter Bunny from 9:30 after the Easter egg hunts from 9:30 to 12:30. And on April 23rd, the El Dorado Hills CSD at their community pool, they're going to have an April Pools Day event where it's free, so everybody can come out and check out the pool. And so they had another presentation from that. That's it for this month. So there's a lot of stuff people can go out and do now with the families and
Spring has sprung, and so activities are increasing, right?
Yeah,
So,
so it's exciting to get back out and do that again.
with the exception of COVID shutdowns in some buildings at the county offices. So it's still craziness going on up there. All right, so I'm going to cover healthy communities very briefly. And for those who were able to attend our second forum on mental health, there was a lot of good discussion about our teenagers, our youth, the mental health situation and stuff. And Cindy actually flagged an article from the Steinberg Institute that's kind of a follow-up, but I thought some of the statistics are important for people to understand. And I'm going to make this short. Mental Health America ranks California 33rd for children's mental health. So 50 states, we're 33rd. We're not doing real well in that ranking, right? And they go on and talk about there's just over 1,000 child and adolescent psychiatrists in the state with more than 8 million youths. So there's a real issue with not having enough psychiatrists, health workers associated with the psychiatry of youth, mental health, et cetera, available. So, so 2 unique counties. I'll mention them. Fresno County and Stanislaus County came up with some unique programs to try to better that. Fresno County in a 2020 report found that there's only one psychiatrist for every 10,000 people. So you can imagine how difficult it is to provide services when you're spread that thin, right? So they actually got into a partnership with the Fresno County Office of Education and the County Behavioral Health Department. It's called All For Youth, and it provides school-based services for people up to 22 years old. It utilizes the State Mental Health Student Services Act dollars. And the bottom line is they're improving the accessibility and the awareness of what's going on with mental health within the Fresno County area. So that's tied with the governor providing more money for psychiatrists, et cetera. So that's going to come up a little bit later. The other county that I think is demonstrating a best practices is my home county from where I grew up, Stanislaus County. The educators there have embraced technology to address student mental health needs, and they've called it the Lifeguard Initiative. The voluntary program gives students an opportunity to identify core values and create growth goals. Students check in daily using a website or phone app to gauge their well-being. Feeling great? Tap the happy emoji. Less than great? The sad emoji. The data helps teachers get a better sense of how students feel on any given day. It also provides students with instant supportive help if needed. So, I mean, that's the kind of creative things that we're doing with the current communication processes and the way everybody uses their personal cell phones. And so I thought, well, that's good. They're using the technology available to try to get interaction with youth that may be struggling. Here's another statistic that kind of surprised me. 75% of mental health challenges begin before the age of 25. So like we talked about with our public health, the importance of wearing a helmet and the formative years and all that stuff, 75% of mental health challenges begin before age 25. So a lot of us tend to think that comes on later in life and it's maybe the senior dementia thing or all those kinds. Not necessarily. A lot of it happens in the youth ages, teenage ages, et cetera. And a lot of the impacts we're seeing now are COVID driven. So they're even higher levels than what you would expect in a normal period of time. So that just emphasizes the need even more. Today, 31 counties with a high need for mental health services report a shortage. This year, Steinberg Institute is sponsoring legislation called Senate Bill 964 and is taking on the workforce shortage with an innovative ideas and a holistic approach. So they really are trying to address it. And then the last thing, awareness of the mental health crisis is translating into action in Sacramento. Last year, lawmakers approved Governor Gavin Newsom's $4.4 billion Children and Youth Behavioral Health Initiative, bringing unprecedented resources to the challenge. So not only has it been recognized what the need is, there's now money to support some of these things in greater amounts than it's ever been available before. But the bottom line is they need to train a bunch of people in the psychiatry field to be able to take on these kinds of positions. And it's been noted by a couple of people that at the county level, the highest two positions that we have at the county are psychiatrists associated with our health and human services. Those people command huge salaries, even compared to our CAO, to fill those positions because it's extremely competitive and there aren't many people that are being educated, to step into those roles. So like the recruitment pitch by Officer Brown, we definitely need people who are interested in getting into that higher education aspect of psychiatry to look at, the opportunities that are here because the funding is there. And from a career perspective, if you enjoy that kind of work, I got to believe it's going to be very satisfying from the standpoint of being able to help people before they get in crisis, right? Recognize it early, get the treatment, get them help, and then you can avoid the longer term impacts if everything works out right. So that wraps up what I wanted to share on healthy communities. And again, we'll put the article in our minutes. So you can have a link and you can go read all the other information that's in it. I thought it was a pretty good short article, but what I'm finding is that the Steinberg Institute tends to take a lead in a lot of these things, and obviously it's named after the mayor of Sacramento, the city of Sacramento, Darrell Steinberg. So they're very involved with it down in the center part of our state, in our state capital, in terms of making these things happen. So I'll leave that, and we'll move on to council member items then, if I'm not seeing any other comments. Our next meeting, I'll remind everybody, is May 2nd. You mark your calendar now. I've invited Mark Riffey or someone else from Pioneer to come back and describe, now that we've got a couple of months of typical savings that we've all received in our PG&E billings that show the Pioneer charge and then the PG&E credit and then the PCIA, how to determine what your net savings are, because there seems to be a lot of people confused on that. When they look at the front page, it just shows an added Pioneer charge. They don't turn to the second page to see the credit. They automatically assume, well, Pioneer's costing me a whole lot more money because I've never seen this before. And so the way PG&E presents it, in my opinion, is very misleading, but they do the billing, so they have the ability to do that. So Mark had previously talked about having an online calculator so that people can go in online to Pioneer with their bill, enter it from, page 1, what is this amount? Page 2, what is this amount? What is this amount? And the calculator will then tell you this is what your net savings are. The one thing I'm hoping he can also share with us is the expectations relative to the PCIA eventually going away, how it would diminish over time as the termination contracts for PG&E to purchase power that's being replaced by a number of the CCNAs diminishes and gets stabilized. As that goes away, the PCIA net rate should go away. Now, that's all subject to the CPUC, and they could approve something else, but if that works right, then the real savings associated with Pioneer will be evident because there's not the surcharge from PG&E on it. But so Mark hopefully will be able to explain all that. I've not heard back a confirmation that he or Alexi or somebody will be able to make it yet, but I'm hoping they can be their guest speaker, and if not, then we'll find another guest speaker for next month. And then the plan would be for the month of June probably to bring back one of our public health presentations on one of those initiatives and kind of roll that in and kind of rotate back and forth. I'd considered trying to get Assemblyman Kiley back in to talk to us, but recognizing with the elections coming up and all that is changing in real time, and I'm not sure there's much real long range benefit of that, because I think most everybody knows that he's running for Congress and he's running in a district that does not include El Dorado Hills. So he's no longer going to be our representative at the end of this year, the way I see it.
And even if he was running for re-election, the assembly district has changed too.
Right. So the boundaries of all the assembly, the Senate, the congressional district, everything got redistricted according to the census, the 2020 census. And boy, when I look at the results of some of the stuff done at the state, I wonder how could that be an arbitrary, neutral group of people that put that together? Because they seem to have stacked the deck in a lot of places, but just my opinion. So that's what the state wanted. And so presumably they got an independent group to do it. So that's what we get to live with and for at least the next 10 years. But we'll all make adjustments when we understand the boundaries, even though some of them seem to be more peculiar than they were in the past. But, all right, so I think that covers it, unless there's any go backs. Did anybody have anything else they wanted to share at this point? Seeing none, I'm going to adjourn our meeting at a little after 7 o'clock here. It looks like it's 7:07. Time to get on a plane.